Okay, you're live.
Good morning, everybody. John Ward, Director of Emergency Management here at the Clay County Emergency Operations Center, where Unified Command is being ran out of as we respond to COVID-19 here in Clay County. I wanted to take this time to reach out to our citizens. We're on day 42 of this activation. I want to say your employees and your team here have been working nonstop tirelessly over the past 42 days in responding to this. And as we continue on, we're waiting on working with the governor to see what he's going to do on starting to reopen. We know the human services side of this is going to run much longer than when we turn the businesses back on. So I tell my staff, we've been here 42 days. We will probably be here another 42 days until we finally get through this thing. As I stated, this has been very trying times for all of us. This has been an exceptional event. No one has ever been through something like this that has impacted us like this. So it's been putting a lot of stress on the team here and a lot of you at home, trying to figure out what the new norm is going to be, and then also when can we come back to work. And then we're also working with residents on, we know there's a lot of people that have lost jobs. We know there's a lot of businesses that are either going out of business or will go out of business because of this. So we've been working very closely with our programs and how to do this. As we continue to move forward, I do want to say, which is why from the beginning I had always pushed to leave the green space parks open, the boat ramps open, because we need folks to be able to go get out of the house and get relief out in our beautiful green spaces or out on the boats, as long as we're adhering to the no gatherings over 10 people and the physical distancing that we do. We need that time to get out and be peaceful. So we brought in a special guest today. Miss Irene Toto is the CEO of Clay Behavioral and has been a longtime partner with us through the years as we've done planning, whether it's been behavioral or mental health or anything along those lines. She's been a great partner. So I really want to take this time, one, to say thank you for being Clay County strong, and there is an end in sight, and hopefully we're coming to that end soon. But I want to take this time to turn it over to Miss Irene and let her talk about maybe some of the behavioral health issues that you may be seeing or what to watch out for as we move forward, because we want everybody to come out of this on the backside much stronger than what we are now. Miss Irene, thank you for coming.
Thanks, John. Appreciate it. Great. So we're going to talk a little bit today about some of the things that John mentioned. We're definitely in an unfamiliar situation. We've never experienced anything like this before. And the unique thing about this crisis is that typically when we're going through a crisis, it affects one person, one family, one neighborhood, one community. This crisis is affecting all of us, statewide, nationally, worldwide actually. So we're all in this together. So there are some real good ways of coping and making sure that we all stay okay through this. Our regular routines have been turned upside down. We have the added stress of not knowing what's coming tomorrow, what happens next. John referenced some of the concerns that people have regarding income and jobs and school and plans that we had. There's a lot of concerns over our physical and mental health. Are we going to be okay? Are we going to make it through this safely? And are our family and loved ones going to be safe? So signs of stress during a pandemic or during a crisis can include obviously fear and anxiety, worrying about your health and the health of people that you care about. We can see changes in sleeping and eating habits, and so we're spending a lot more time at home. So you may find yourself sleeping more, sleeping less, eating more, eating less. Those are things just to be mindful of. Definitely we could have trouble concentrating or focusing on tasks. That's pretty normal with the level of stress that we're dealing with on a daily basis. If a person has a chronic health condition, that could be a physical health or a mental health condition, we may see worsening of that condition through stressful times. Definitely could see increased use of substances, so that could include tobacco, nicotine, alcohol, caffeine, and other drugs. And also pretty persistent feelings of helplessness and hopelessness, really not knowing what to do next. So there are ways to take care of yourself. John mentioned getting out, getting some physical exercise and some fresh air, great thing to do, as long as you do it safely and appropriately, following the guidelines. I think not watching the news 24/7 is a good idea, right? So limiting that social media, and that applies to adults and children. Kind of limit screen time internet exposure, social media, TV, television news, just limiting that, right? You want to get the facts and you want to stay informed, but 24/7 exposure is really not healthy. It's good to take time to care for yourself and your family. So we're spending a lot more time together, and even when you're spending time with people that you love, 24/7 is a lot of hours. And so it's good to have some time to yourself if you can separate into another room or give your kids some space to be by themselves. Definitely good to get a little bit of separation, even though we're really spending a lot of time together. So we talk about physical distancing. Definitely need to do that, but there are plenty of ways to stay connected. We've got a lot of technology options, so we can FaceTime or WhatsApp or Google Duo, or there's a lot of ways for us to see each other and talk to each other, even though we may be in different spaces, and those connections are super important. The stress of staying at home, maybe not being at work, not being at school, not doing our regular routine, can add a level of pressure on us. So being able to stay connected and see that people are safe, and a lot of really fun, creative ways to use that. So we've seen people have celebrate birthday parties via a virtual platform. So you may all be spread out in your own homes in different states, different locations, but there are ways to use those video platforms to celebrate a birthday or an anniversary, or to check in with a relative or a loved one. Netflix has a Netflix parties, which allows folks to kind of watch videos together and synchronize chat and kind of have that virtual experience of being together. Things that, kids have a lot of questions, and I think it's important to talk with your children about the COVID-19 and what's going on. Give facts, be reassuring. They want to know that they're safe and that their world is going to return to normal. And as a parent or caretaker, you just want to be that person to reassure them and let them know that things will be okay. And limiting their exposure to media is also very important. Try to keep regular routines. So for kids that are doing online school, which is all of our children, really keep routines and it's a different routine, but a routine is going to be really important. Maybe set some goals and have some tasks to accomplish. Make those reasonable goals and reasonable tasks. But being able to have a list of things to do and accomplishing them can really give you and your children a sense of mastery and accomplishment. Always good to talk about future plans. So when this is over, what are we going to do? Where are we going to go? How are we going to have some fun when we're able to get out of the house and get back together with our family and friends? Warning signs, what you want to look for. So the stress is normal, but when it becomes persistent, when your mood stays low, when you're having a hard time finding any joy or laughing, that may be a cause for concern. Obviously, increased use of substances, alcohol, or other drugs in particular, if that use is increasing or you're relying on that, maybe time to get some help, professional help. We talked about a persistent low mood or feelings of anxiety that won't go away for more than a couple of days. Probably time to get that checked out. And if you have physical health concerns that are worsening, maybe a chronic condition or physical symptoms that are coming up new, and they persist, then probably time to consult with a healthcare provider. We know that certain people may be more vulnerable during times of stress. So if you have a history of a mood disorder or depression, if you have a history of substance abuse, a history of anxiety, or a past history of trauma, you may be more vulnerable. And also folks that we really need to be mindful and aware of their stress levels is our frontline workers. So these folks at the Emergency Management Center, our doctors, nurses, healthcare providers, first responders, really need to check in with them and make sure that they're doing okay. They're doing a lot to help others, but we need to make sure that they're also taking care of themselves. In children, you may see changes in mood. You may see the changes in sleeping or eating. So if your child is not wanting to get out of bed or not wanting to go to bed, maybe something to explore a little bit more. And also may see kids kind of revert to behaviors that are that they have outgrown. So if they're crying a lot or being excessively irritable, or may see some additional behaviors that you hadn't seen for a while, it's a way of coping, but if it persists, you also may want to talk about getting some help for that. We can see some irritability and acting out in kids, often teenagers. So if the warning signs continue, definitely time to seek help. And how do you seek help? That could be reaching out to a trusted friend. So if you have a connection that's been a support for you in the past, reach out to them and see if you can talk through some of the issues. A mental health professional, I'm happy to say that the mental health system has really been able to make the switch to telehealth and telemedicine. So there's a lot of resources available that'll keep you safe and keep the mental health professionals safe. Clay Behavioral Health Center is our local resource. We're the community mental health centers providing mental health and substance abuse services to Clay County. Our phone number is 291-5561. And that is a 24/7 number, so someone will always answer the phone. And I think it's just a good resource. Not that we can provide all the services that folks need, but we are definitely a resource to refer you to the right place. So if our services are not a good fit for you or not available at this time, then we definitely have the resources to refer you out to folks that may be more appropriate. Maybe you have a faith-based connection, a pastor or a member of your church that's been a support. That's also a good resource to try to connect with and see if they can provide you some relief to the anxiety you're exhibiting. And a primary health care provider also using a lot of telemedicine, so perhaps your primary care doc or an ARNP may be able to offer you some suggestions for moving past the anxiety that you're feeling. So I mentioned Clay Behavioral. There's also some national resources available. The National Suicide Prevention Lifeline is available 24/7. That number is 1-800-273-TALK. 1-800-273-TALK. It's 8255. Also, some younger folks and some of us who may not want to talk to someone over the phone can use a text line. So the National Suicide Prevention Lifeline also has a text line, which is available 24/7. If you text HOME, HOME, to 741-741, that text will be responded to 24/7, and you will get a text back from a trained crisis professional. And the disaster distress line is operated by SAMHSA. That number is specific to people exhibiting crises during times of disaster, which our current pandemic is. So that's 1-800-985-5990 for the disaster distress line. You can also text the disaster distress line, and so you would text the words "talk with us," one word, "talk with us," to 66746. And again, you will be connected via text with a trained crisis professional. So there's a lot of resources out there. If friends and family are not available or are not enough, reach out to a professional. Give Clay Behavioral a call and see if we can direct you in the right direction. In Clay County, we also have a mobile response team, which we've changed operations a little bit, obviously, with the current situation to keep people safe. So we're able to do telehealth and video conferencing. So if you're experiencing an immediate crisis, obviously 911 would be your first choice, but if it's a behavioral health crisis related to mental health or substance abuse, the mobile crisis team is available in Clay County. That number is 291-4357. So it's HELP, 291-HELP-4357. And typically that is available to folks up to age 25, but we've expanded that operation, so that is available to, we've had folks calling us because they needed to talk or were experiencing a crisis. So definitely call, reach out to the mobile crisis team if we can help. And I think, to end, I would say that, again, this is a crisis that is affecting us all. There's a lot of really good things going on. If you can focus on the positive and try to feel gratitude. It may be challenging to be grateful when you have so many fears and anxieties, but gratitude has really been shown to release very positive chemicals in our body and make us feel calmer. And perhaps a little happier. So if you can feel gratitude, and if you can do something for someone else, have your kids make a card or a craft project, or do something for someone else. We do know that when we do things for others, it not only helps the person we're doing it for, but it also helps us feel better. And just be on the lookout. So if you know a family that you're concerned about, or a friend that you have some concerns over, reach out to them. Doing for others will likely make you feel better. I think we've all said over and over again that this is a crisis that we're all in together, and we will get through this together. Thanks very much. Take care.